Hi, my name is Haley. I'm one of the assistants here at CVD Kids. I'm with Dr. Rena today, and we are going to talk a little bit about Airway. So what are some of the Airway focused procedures that you do here?
Good question. So we usually start kids off in a tooth pillow, which is this handy dandy thing. It's pink for girls and blue for boys. Comes in your own case, and it's multifaceted and it works in so many different ways. But one of the most important things that it has is a little tongue tab at the roof of the mouth. And so that helps strengthen the tongue while your child is sleeping to help reach the roof of the mouth. And the reason that is really helpful is because, first of all, the tongue being strong enough to rest on the roof of the mouth helps naturally expand everything. So actually a lot of underdeveloped jaws stem from a tongue tie, which is super surprising. But after strengthening the tongue, the other thing that it does is when the tongue posture is not too low and actually is able to reach the roof of the mouth, the jaw literally closes. So that's where we want everyone's tongues to be. And then the last really important piece about this is that it sets the jaws in the proper formation. So it keeps the upper teeth in those divots and the bottom teeth in those divots. So if you have it in your mouth, it kind of looks like an orange peel in your mouth when you smile, but it's thick for a reason. It keeps your jaws positioned properly. So yeah, we start kids off on that at first.
And then what is the next step with the tooth pillow?
Right, so after the tooth pillow is done, we transition kids to an expander. So the lab sends it to us on this little tooth model, and it has a little screw that hangs from the roof of the mouth, and these get retained on the upper back teeth, the molars. And so then the parent takes their little wrench or their key and turns this literally just once a day. It does not hurt at all, but what it does is it helps widen the upper arch, like the roof of the mouth, which helps lower the roof of the mouth, and then a kid can breathe better through their nose. So once we do the tooth pillow for a few months, we scan for these and we do upper and lower expanders. It's pretty cool.
And then I do have one final question.
Yeah.
Why is Airway so important to you?
Yeah, great question. I feel like we're able to save lives at a young age. That's the most important thing to me. So diagnosing kids with an underdeveloped jaw helps them breathe better their whole life and help not develop sleep apnea. My husband has sleep apnea, and it was all because of a tongue tie. And I wish that we could have figured that out earlier, and unfortunately it goes undiagnosed very often. Unfortunately, a lot of orthodontists, ENTs, pediatricians, and even dentists don't know enough about Airway, and that's not anyone's fault. It's just not, it's not taught in dental schools. I've had to take a lot of courses on my own because it's so important to me to make sure that kids breathe better, sleep better, and don't develop sleep apnea, which is a huge risk for cardiovascular issues and dementia. So,
well, thank you so much for sharing about your passion about Airway.
Yeah, thanks, Haley. If you guys have any questions at all, give us a call.